And today we'll talk about the journey of addiction and addiction recovery. The first thing to note that it is a journey, and a journey takes time and goes through stages. So we'll discuss this. This is of great benefit to the patients who we have in the center at the moment and their families. And also for those who have left, it's a reminder of the journey they have walked through, and they are still walking as they are still in recovery. So addiction, we always say, is a disease that affects the human body all round. It affects the body, the mind, and the soul. And when someone is going through an addiction process, the disease starts from one part of the body and moves through the rest of the parts of the body until by the time they are coming to rehabilitation, it has affected them all round. So I'll quickly just go through the stages for the addict. Usually before you start being addicted, you are a normal person. And all of us, you are not even taking your substance of addiction. And so we have the first stage I call the before addiction. And the before addiction is for a normal person not taking anything. So the important thing to note at this stage is that there are factors that play, which eventually will drive person towards the path of addiction. And some of them I've listed here: the family and the social surroundings of the person. If you are in a family where addiction has been running for a long time, you probably got exposed very early. And if your social circumstances are such that they are favoring or promoting use of substances of addiction, then you are likely to get introduced early. And this goes also with belief systems, because people practice what they believe, whether it's a family level or community or individual level. Then the genetics, we say addiction can be hereditary. And this is true that if your family line has got history of addiction or mental health problems, then they may affect you. And together with the belief systems, we have myths, legends, things that people say, which reinforce the belief that using alcohol or drugs of addiction may be a good thing. Then these myths and legends are usually perpetuated through peer influence systems. So your friends tell you, for example, that if you want to crack that exam, you just need to smoke some cannabis and you'll understand those difficult concepts. Those are myths and legends which are passed on through peer influence, and they start to affect the individual as they start to experiment. Then as they start to experiment, they move to the first stage, stage one, where the body is the one that is affected. The experimental stage, you are trying out this thing, you are believing some of the myths and legends and the things you are hearing, and your family and social circumstances are tolerating, promoting, or enabling this behavior. And so at this stage, you are a user of drugs of addiction who is okay. You drink, you go home, you sleep, you wake up, you go to school, you go to work, or if it's Mira, if it's cannabis, whatever you use. And when you are finished using, there's a short period of being intoxicated. And after that, you're okay. So you are still at the experimental stage. Most of the people in this stage are usually young people. They are just starting, and their bodies are strong, so they are able to weather the effects after a short while. But as they continue, they experience what we call positive or negative reinforcement. Positive reinforcement is that you've been taking and you feel it is okay. You concentrate on the positive things that you get. You feel high, you feel happy, you dance, you talk to people, and you feel energetic, and you feel this is fine. So you will continue using more. Negative reinforcement is where after using, you got into some problems or undesired things, and you thought probably I shouldn't have drunk, because if I hadn't drunk, I would not have had that road accident. So you start feeling like the drinking or the using of drugs of addiction is not helping, so that's negative reinforcement. And this is important for families, particularly that when you have young people or people who are still at the experimental stage, it's important to bring in the negative reinforcement, that you pass the message that this behavior you are starting to engage in, although right now you seem to be in control and things are okay, is going to cause you problems later. Because if they don't stop, they move to the second stage, which still affects the body, but it has become entrenched, and now we call it a regular or social user. At this stage, this person uses the drugs of addiction on a very regular basis. They also engage in a behavior that is risky associated with this usage, but they mitigate against it by saying that it does not deny them something. They're just using the drug of choice for recreation purposes, but it's on a very regular basis. And at this stage, we have what we call a dichotomy. People can, at this stage, stagnate or remain in that social usage stage, or some can quickly deteriorate and move to the next stage we'll discuss shortly. And so there's no way of knowing who will take which route, but it's important to know that forestalling the effects, the progression is the best way to make sure that people do not get into problems about usage of drugs. And then also at this stage, if someone has got mental problems, they tend to add up to the bad effects of usage. It is known that most of the mental health problems have got an additive effect with usage of drugs of addiction. And it's at this stage that it starts to show, and they feed into each other and make the process worse. As a person progresses to the next stage, which is the third stage, this is the stage where a person is now abusing. They are engaging in a risky use of the drug of addiction, and everyone around them, the family, friends, are starting to see that this person is taking the wrong path. People are saying you drink too much, you're failing on some responsibilities, and people are starting to backbite you, to point fingers at you, some to shun you, because your use has gotten to a risky stage. At this stage, the dichotomy I talked about in stage 2 is that the person who is a social user has now progressed to a problematic user. And this stage is a stage where the effect of the drug of choice, what you are abusing or using, is moved from just affecting the body to affecting your mind. And this is a significant development because, as we started, I said addiction affects body, mind, and soul. So at this stage, your mind is starting to function like the mind of an alcoholic or a drug addict. You are someone who now orientates your mind, your thinking, your action, your thought processes to fit with the drink or the drug of choice, okay? So you are someone who can as well go out and tell people about the drug of choice and convince them. You are becoming like an evangelist. You are able to go and preach about your drug of choice and get people to join you because you've now started believing in this thing in your mind. So it's not just the body, but the mind. This is not arrested. They progress to the last stage, stage 4, where it is classical addiction. And at this stage, it's not only your body and mind that are involved, your soul is also involved. And what do I mean by soul? Soul, for this purpose, refers to belief systems. The commonest example we have is religion. We believe in God. We may be Christian, Muslim, we may be Hindi, Hebrew, but we believe in a higher being, a higher power, which guides us through life. Now, when people get into stage 4 of addiction, they also start believing in their drug of choice like they believe in God. They have totally succumbed to the effects of this, and now they believe in it the way they believe in God, and they feel they cannot turn away. It is part of their life and it is part of their fate. So they would say, for example, if it is going to kill me, then that is what God planned for me. There's nothing I can do. And at this point, there is nothing this person can do on their own unless other people, family members, or other people in the community intervene to help this person. And the interventions that are available, the best is rehabilitation. So a number of people come to rehabilitation at stage 3 for those who the family has detected early, and others, the majority, come at stage 4. At stage 4, they are brought in. They will not come themselves. And even when they come, they still feel they're being pushed into something that they don't want. People are interfering with their lives. But when you look at them, they have sunk to the rock bottom. They have lost their job. They have lost their livelihood. They have lost their family. Their health is poor. But what just remains is that self-justification, like, yeah, maybe it was bad, but it's because of this, giving excuses when in fact they are really down. So in brief, these are the stages, and they progress in a steady upward form, the way you would talk about climbing stairs. So you start as an experiment, it becomes a regular usage, then your usage becomes risky. People start noting that your usage is causing problems. And the last stage is where anyone, even someone who has never seen you all their life, they see you for the first time and they see this person either has a serious health problem or they are addicted to some drug of choice, because even their health is not good. So at stage 3 or stage 4, they are brought to the rehabilitation center most of the time. And then now we move to the recovery stage, which starts at rehabilitation. And the recovery stage also moves along phases just like the addiction stage. So for you, our patients who are in the rehabilitation center right now, you may identify with some of these stages that I will talk about. And this talk is meant to enlighten you and your families and to encourage you so that you know that you are really on this path of recovery and you remain determined to finish this journey. Like some of the patients who have left, the alumni who have just been talking, some of them have passed through this stage. They are towards the final stage, which I will talk about as I finish the parts of recovery. So the first stage, when they come to rehabilitation, first, we are receiving someone who has not received any rehabilitation. So what they are exhibiting is what they have been doing out there, and we call it the addict's world. We have the addicted person in the center, but still living in the addict's world. You look at them, they have signs of decline, body, mind, and soul. Their body is unhealthy. Their mind is unhealthy. Their soul, their belief systems are unhealthy. So you have this person who may come in, probably they have liver disease. You can see their abdomen is swollen or their legs are swollen, so the body is sick. But they still talk like there's no problem. Something just went wrong. Maybe I ate some food, or there was just some other problem. They are not seeing the link between their bad health and alcohol. So their mind is not okay. And then they still believe that they can drink, they can take their drug of choice and they will not have a problem. It's just a turn of bad luck. So again, they have not realized that they are really in a ditch. So we say we receive people who are in decline, body, mind, and soul. At this stage also, We may, unfortunately, and I say it's unfortunate because it's not something that we wish to have, but sometimes we receive also people who come brought in by families that are enabling. And enabling family systems is one of the discussions we have during our family day like today, and probably the next one we may talk about it. Enabling is a situation where the family makes it easy for the person in addiction to continue using their drug of choice. They always give excuses. They always help this person out. If he's arrested by the police, they're the first to be there to bail them out. If it's work, they will call in and say the person has malaria when in fact he just drank last night and could not go to work. And then also, we have a situation where involving both the person in addiction, the family, and the community around, we have a situation where some people have been practicing what is called faith without action. This means this person, family member, has been using drug of addiction and has gone to the rock bottom. But for a long time, you just wished that they would be okay. And you even prayed and you just said, oh, maybe one day you'll change. God, please just change it. But you didn't do anything. The day you bring him or her to rehabilitation, that is the day of action. And as you start the first month, we now say you have transformed from faith without action to action and faith. And so you've brought him or her to rehabilitation and they check in. When they check in, the journey of recovery starts from the body. The body is the easiest to treat.
Hi, sorry, can I just ask if people can be on mute? There's a lot of interference. Sorry.
Yes, kindly unmute. Has everyone muted?
Yes, it's fine now. Thank you.
Okay, so I can continue. So as you check into rehabilitation, the first month, we start by rehabilitating your body because the body is the easiest to treat in rehabilitation. So our famous treatment for the body is detoxification treatment, and you hear us talking about it a lot. Detoxification means we are using medical therapies to return the body to where it was before you got into addiction. And so if you have malnutrition, you've not been eating well, we want to give you a healthy diet. If you have deficiency of various nutrients like most people do at this point in time, we want to replace these nutrients. If you are dehydrated because you drank last night and you've been vomiting, we want to rehydrate you. If you have high blood pressure, we want to control blood pressure. If your blood sugar is bad, we want to treat it. If you have ulcers and you cannot eat and retain food, we want to treat ulcers. All these medical therapies combined are what are called detoxification treatment. So detoxification can encompass so many things depending on what the person presents with. And when you come, we normally do an assessment which tells us this person has this health problem for the body, and we will require this and that, okay? And at this stage, away from the body, the person's mind is still the mind of an addict. Most of them are usually in shock and denial. Some of them have been brought by force. So they are still saying they were just brought there by mistake. Someone should not have done that. They don't have a problem. Some of them even want to leave. The following day, they want to say, I want to move to outpatient because this one is not for me. I am not an addict. And I go to work and I do my things, so I'm not that bad. They are in denial. Some of them are scapegoating. Scapegoating is blaming the other persons except yourself, blaming other situations except your situation. And during the first month, we accept this person knowing that they will have a bit of problems settling in, most of them, because they have to accept that, yes, there is a problem, there was a problem, and I need to do something about it. It takes time. as we are treating the body through the detoxification treatment, we are also applying psychotherapeutic techniques, counseling techniques to make this person realize that the problem is with them and not their mother or father or husband or wife, and they need to accept to get a cure. Usually, by the second month in rehabilitation, most of them have healed in the body. The detoxification has worked. They have gained some weight. The skin looks better. They can sleep better. Their bodies are healthier. And so they're starting to feel nice about themselves. And when the family members visit, they will say, oh, you look better. He looks now like a human being. That is detoxification having worked. And usually, again, by the second month, we have moved some steps forward in convincing them that, yes, there was a problem with them and not their family. There's less of denial, there's less of scapegoating. So they move into a world of reality. After the physical healing, reality starts to hit them that, yes, there was a problem. So they start to negotiate. Some of them feel guilty. Some of them may not feel guilty. They may be defiant, those who are still in denial. But there's some sort of negotiation. And some will tell you now, I think, yes, there's a problem, but I just think mine is not so big. I think I can just stay for 1 month, then I will go. I think it is okay. I now understand, and I can just be calling you when there's a problem and you advise me. They're negotiating. They feel a sense of guilt, responsibility, but at some point, again, they feel like, no, it's not that bad. So this is the stage where we fail or succeed. We succeed if we make this person further internalize that they had a problem. We make this person accept reality more. We fail if this person remains defiant, does not accept reality, and they still feel they're in the wrong place. But for those who succeed, the majority of them succeed, they move to a stage of reflection, negotiation, and acceptance. They start to think about their life, they start to verbalize, they talk to our counselors more, and the family, they start to talk to them more, they negotiate, they make peace, because some of them, by the time they brought, family relationships are not as good, and they accept responsibility. So there's a trade-off at this point, and we progress into the third stage, where the real healing starts. And at this stage, it is the soul that is involved more. You start to see that the things I believed in were not really true. I can live a life that is righteous. I can live a life that is successful. I can be someone that's appreciated in this world without having to indulge in drugs of addiction. So you are changing, you are converting your soul, like you are getting born again. And when they reach that stage, we now replace guilt, defiance, reflection, negotiation with hope. They become hopeful for change. They become awakened. They start having goals and plans. They start looking forward to meeting their family whenever family visit. We see more happiness at that point. They now start talking to family members who they had sworn I'll never talk to that person. So they have a spiritual rebirth. And this is a time when we are very active with our psychotherapeutic techniques and approaches. And we are engaging these people so that they can believe in the change that is happening. They can start planning about living rehabilitation and doing things a bit more different. So they then move to the last stage where they leave the rehabilitation. And if they have successfully moved through the journey, they live full of ambition. They live feeling like they can fly, they can achieve, they can make up for lost time. And usually our work at this point is to moderate their expectations, to make them realistic. So the exit plan that we work with them and their family is such that they are able to have realistic expectations, and we support them as they go out. I've had some alumni saying they have been applying for jobs. Jemima said 16 applications the last 1 week. So you see, you live with those feeling like, now I'm sober, I can do anything. but the world out there can frustrate you a bit. And so we support them so that they don't sink into despair again, because if they do, they'll go back, they will relapse and go back to usage, so the cycle repeats itself. It's worth noting that at this stage, when they leave rehab, some may sleep, some may relapse, and may require rehabilitation again. A sleep is where kuteleza kidogo, you just went out and something happened and you tasted a drink after a long period of soberness. But then you realize you had made a mistake, you are remorseful, and you change. A relapse is where you go back to the old ways, you don't care anymore. So usually this stage of after rehab, the new world stage, we are trying to prevent that by making the expectations realistic, supporting them and working with families. And then the journey continues until it is completed and someone can say, I have been sober for the last 5 years, 10 years, and you feel like, yes, this person was once an addict, but they converted and now they are okay. I'll leave it at that and hand over back to the moderators. Thank you.